Hi, my name is Dr. Arlene MacDougall, and I'm an assistant professor of psychiatry and epidemiology and biostatistics at the Schulich School of Medicine and Dentistry. My areas of expertise include the study of mindfulness interventions in supporting people with mental health challenges, as well as looking at how we can use social innovation approaches to improve the mental health system locally and globally. So as a psychiatrist, I have seen the impacts of the pandemic on people who are already struggling with mental health issues, including mood disorders like depression, as well as anxiety disorders like generalized anxiety and social anxiety. What I've seen is that people have really struggled with maintaining a healthy mood, given the context of not being able to engage in activities that are meaningful to them and not being able to see the people that they care about, as well as having changes in how they work or study or socialize. So people may be feeling anxious about the reopening for a number of reasons. One could be that they're worried that they'll be put at risk of contracting COVID and or spreading it to other people. So some of the factors that are driving people's anxiety or trepidation about reopening is the uncertainty. We, at this point, don't know, for example, how long, vaccine immunity will last. We're unclear whether there's going to be, new or evolving variants of concern and how the vaccines will respond to those. And so we're unsure, what the risk level is going to be in a few months from now, let alone, in a year's time and moving forward. And so with that uncertainty comes a lot of anxiety about, what does this mean to me in terms of the risk to my health and the risk to, my loved ones and others in my life. And another concern could be just feeling uncomfortable with being in a social setting, having not been in a social setting for quite some time. Others may feel anxious because they're not sure how to maybe share the different challenges and losses that they've experienced because of COVID. And these are difficult topics, and there may be discomfort about how to begin to share that in a more social or public space. So in terms of how do we move forward with re-entering back into our school settings, our work settings, or our social settings, it's really about, sticking to the facts and following what the public health guidelines have been, knowing what your risk tolerance is in terms of the number of people gathering or the vaccination status of people that you're gathering with, and be really open about what your risk tolerance is, as well as respecting the risk tolerance of other people and having that discussion, even though it can be challenging at times. There is, some groups of people who may have particular challenges returning with the reopening into society. For example, those with social anxiety disorder who already have significant worry and fear about what others may think of them or how they might judge them. And so they tend to avoid social situations and have been able to because of, the restrictions and the lockdowns. And for those people, it would be very difficult to return back into kind of public and social settings after this extended period of time of being able to essentially avoid it. So they may have, heightened sense of fear or physical distress, even thinking about returning, let alone doing the actual physical returning or the behaviors involved in being social again. So I could see that group struggling for sure. And for those that have that type of anxiety, the important part would be doing it in smaller steps and being consistent about, increasing your exposure to social situations gradually instead of avoiding it completely. It is going to be critical that we support each other through the next phase of this pandemic. It's going to be us together helping each other that will help us to recover and heal from what we've just been through. Now, for people who are struggling more and it's really affecting their ability, for example, to work or to engage in learning or school, or even to have those interpersonal connections, more care may be needed. And so I advise them to seek out care from their family physician, or look at the possibility of going to a regulated health professional who does, cognitive behavioral therapy or other forms of psychotherapy to manage mood and anxiety or other mental health issues like substances. There's a lot of resources in our community. There's also resources available online that are free and funded by the Government of Ontario. Those include Bounce Back Ontario, as well as Mind Beacon. So both of those programs provide free mental health therapy and supports.